Here investigation of diabetes mellitus. First test, mini glucose tolerant test. This one is the short glucose tolerant test. As per current World Health Organization recommendation in the estimation of blood glucose in the overnight fasting and post parental samples, fasting and post parental samples. That means after 2 hours 75 gram glucose mixed with water to confirm the diagnosis of diabetes mellitus. So here overnight fasting and after glucose load we collect sample, one sample. So this test assess body respond to glucose. Here we will give sugar solution 75 gram of glucose mixed with 300 ml of water. Then assess the result by blood sample. Measure how well body cells able to absorb glucose. By using this method, we can measure how well body cells able to absorb glucose. So, glucose tolerant test. Normal fasting plasma glucose less than 100, 2 hours less than 140. Impaired condition 100 to 125. Then diabetic condition more than or equal to 126. More than 200. After glucose load, that patient affected from diabetes mellitus. Second condition, extended glucose tolerance test. Here extended glucose tolerance test give clues about symptoms that only may have experienced that would be caused by a low blood sugar. Patient feels symptoms they have experienced. They have low blood sugar means they will do this test. This test also provide information about our body's production of hormones. Okay, so it is called that hormone, insulin hormone production estimation also we can use. Thus extended glucose tolerant test has been used for variety of purposes such as detecting reactive hypoglycemia condition. Hypoglycemia condition means hypo means low blood sugar level, and defining substances of hypothalamic substances, then obesity, then insulin resistance or deficiency. These are the things we can estimated. So this extended glucose tolerant test provided information for our body producing hormone like insulin. Then detecting reactive hyperglycemia condition, then defining substances of hypothalamic, obesity, insulins. Blood samples are to be collected at 30, 60, 120 and 180 minutes for glucose, insulin and C-peptide. So, estimation of glucose, insulin and C-peptide 30, 60, 120 and 80 minutes interval we collected samples. One may even need to extended this one like this we want to extended up to 5 hours. An extended glucose tolerance test is variation of standard glucose tolerance test that involved in monitoring blood glucose level for longer duration, 3, 4, 5 or like that. It provide more comprehensive assessment of how our body handle glucose over an extended period. Like the standard glucose tolerant test, it is also required fasting and consuming a glucose solution. Next test, glucose challenge test. Glucose challenge test, GCT. Here 50 gram of glucose dissolved with 250 to 350 ml of water drink that solution. After 1 hour only, we collected that blood samples to measure blood glucose level. This one we can do anytime, no need for fasting. Here we want to tell a patient to drink that glucose solution. This one mainly used for pregnancy period. That gestational diabetes isolation, mainly we collected sample in between 24 to 28th week. Next one is intravenous glucose tolerant test, IGTT. This one rarely used, never used for diagnosis of diabetic mellitus condition. Here glucose injected in vein for 3 minutes. Blood glucose level measure before the injection. When use when person anti-islet auto antibodies. Again, insulin level measure 1 to 3 minutes after the injection. So here this one rarely used test, never used for diagnosis of diabetic mellitus. Glucose we can inject it through vein. So that reason only it have that name intravenous. This one use when person anti-islet auto antibodies. What is anti-islet autoantibodies? The anti-islet cells antibody are present at 90% of patient with type 1 insulin dependent or juvenile diabetes. So identification we are using here glucose 25 gram per deciliter is injected into vein at 0.5 gram per kg body weight, maximum 35 gram over 5 minutes, and insulin level are measured before and 1 and 3 minutes after glucose load. Then infusions. Blood samples for glucose determination are drawn immediately before glucose injection and thereafter every 10 minutes for 1 hour, mostly used for research. So in this video, various glucose tolerant test. First one is mini, second one is extended up to 5 hours extended. Then glucose challenge test. After 1 hour we collected the samples. Then intravenous, this one not used for diagnosis of diabetes mellitus, mainly research purpose we are using. Thanks for watching.